many of you, when you're going to read this question, you are going to mark the answer as no post-operative treatment needed. But please remember, no post-operative treatment is needed when it is stage 1A, grade 1, grade 2.
So this is a clear-cut X-ray suggesting that the head of the femur is outside the acetabulum, Shenton's line is broken, thigh is adducted, lesser trochanter is not visible, so must be internally rotated. So this is a posterior dislocation of hip.
The child is using the hands over the proximal group of muscles and he is trying to climb up. He is having weakness in the proximal group of muscles, which is what we call as a Gover sign.
In some people, 8 to 10 months post-COVID, okay? And in some people, any time in between. That these people are actually coming up with vasculitic manifestations.
In one of the tables, they've written that please don't clamp the tube in a patient with hemothorax. Let the blood come out so that you can assess quickly if this patient requires an emergency thoracotomy or not.
Dry submarine, plastic bag asphyxiation, completely closing the mouth and nostrils. Person cannot breathe, that's called dry submarine.
Once I know these are my pars plicator, from pars plicator there will be zonules, and in the center will be the lens. Behind the lens will be vitreous, in front of the lens will be aqueous.
All this line of deers, they want to cross this wall and go towards their food. Similarly, the leukocytes will cross the basement membrane and go towards the site of injury.